You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, keys to a natural looking facelift. We're talking about natural results today and what you need to know if you don't like the way you're aging. With us, we have an expert on the topic. He's a board certified plastic surgeon, Dr. Kenneth Kim. Dr. Kim, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, for people that don't know your practice in Beverly Hills, who's the typical patient? What are the different services you offer? Tell me a little bit about it.
Well, I perform facelift, eyelid surgery, breast augmentation, and other cosmetic surgeries. And I'm an assistant clinical professor at UCLA School of Medicine, where I teach plastic surgery as well.
Okay. Now, you also lecture all over the country and out of the country on some of these new techniques.
Yes, because I think that a lot of the surgeons are very interested in these advances, and so I think it is worthwhile to share the information.
So tell me a little bit about your background and your training.
Well, I went to UC Berkeley for my undergrad, and then I went to Yale University for my medical school, and then Northwestern for my plastic and reconstructive surgery. I also did a lot of research. I did research in Switzerland, where I studied minimally invasive surgery, and also did wound healing and tissue regeneration research at the Howard Hughes Institute as well.
Okay, now what's the typical age of a facelift patient these days?
The typical age of the facelift can be anywhere from in their 40s all the way to 70s or even 80s, because people are living much longer.
Okay, so tell me a little bit about your practice, because we've talked on the telephone, you feel like you have a special practice, also a very unique way, the way you approach the facelift. So tell me a little bit about that.
Sure. So I specialize in what is called a minimal bleeding surgery. Okay. So minimal bleeding surgery means that during surgery, you're really avoiding bleeding. So why is that, and why is that important in facelift? Well, there are a lot of blood vessels, Randy, in the face. So face is considered what's known as very vascular. Okay. And so when you're operating, and if you're hitting these vessels, then obviously blood will seep out, and it will be surrounded in your tissue. And the reason why that's bad is because we need blood flow to our skin. Okay. And so the key to youth and health is maintaining that nice, robust blood supply. And another bad thing about blood in our soft tissue, so the blood belongs in our blood vessels and where it's supposed to go. But if you disrupt the blood flow and the blood is in the surrounding tissue, then it causes inflammation. And what inflammation is that what it does is that it causes pain and it causes swelling. So people think that it is really like cutting skin that causes pain and trauma, but really is due to bleeding, and another very important thing, which is internal trauma. Yeah.
How does this internal trauma affect the result or the facelift in general?
Sure. So the internal trauma, so our face is made up of layers. And so it's just like an onion has a bunch of little layers. It's just the surrounding layers. So our faces, and throughout our body, we are made up of layers. And if you think about why we age because there's a layer that has descended. So our tissue has layers that are very stuck together, and we also have layers that are very loose. And if you think about the aging process, when people develop these jowls and nasolabial fold and the neck, they slip within this layer. Okay. So if you find that layer, and then if you operate within that layer, then there's significantly less internal tissue trauma.
Okay, what about, now how do you find this layer, this particular layer?
Sure. So before finding it, I think what's really important is that this internal trauma is so critical in terms of how you heal and also how you do surgery. Okay. So the answer to how you find this internal layer is that I deliver fluid. So fluid as in water. So water mixed with special fluid, special material, special components. And so basically the fluid, what it does is that fluid will find the area of least resistance. Okay. So imagine I spill water here. Yeah. Okay. The water will go to all the little cracks and will find the area of least resistance. If I pour water here, the water will seep through the fingers, right? Yeah. So you can't really hold it. And so the same concept is that if I deliver fluid into the face for the facelift, then it will find that layer where the tissue naturally wants to open.
So do you believe that you get better results because of this? Because, you know, we talked on the phone too about that you say that women that come in, men that come in, nobody wants a pulled tight look. It's like a dead giveaway. It's like you could spot the person with a facelift across the room.
Sure.
So tell me about that. How do you avoid that? Is that in the hands of the plastic surgeon? Is that just the way they healed improperly? You tell me.
Sure. So you get a pulled look because the person is pulled. Okay. It's actually quite simple. And so if you think about a facelift, the incision goes along the ear. So if it's coming from the side, and then you have to think about where is the problem area. So if the audience, if the people who are watching the show, if they look at their face and then they see how they're aging, what are the areas that are most bothered? They're bothered by the nasolabial fold.
Okay.
They're bothered by the jowls, right? And then they're bothered by the neck. And so where is this area? The area is actually more towards the middle of the face, what we consider as a midline, right? So more towards the middle of the face. But the surgery is done from the side. And so, but what happens is that surgeons typically come about halfway and then they pull. And so when you pull, of course you're gonna have that pulled look. Imagine I have my suit here and then I decide I'm gonna pull on something. So if I pull, you're gonna have that pulled look.
Okay.
Because it is being pulled.
Yeah.
And it's tethered, right? So when something is tethered and I pull, then it's bound down. And of course you're gonna have that pulled look. Just like a rubber band. If you pull on it, you're gonna feel that pulling feeling.
So how do you avoid it?
So the key is to freely dissect all the way to the area towards the midline.
Okay.
And the key point is going back to what I said about minimal bleeding. Because the first thing I said is that our face is very vascular. Again, what that means is our face has a lot of blood vessels. So as you're operating, if you're hitting these blood vessels, one, and number two, if you're not operating the optimal perfect layer that you should be operating, then there's gonna be a lot of bleeding. So you can't see what is what. And therefore, you can't go all the way. But if you follow this optimal tissue layer, then you can go all the way, and then you could release it. And then rather than pulling, the term is reposition.
Okay.
So if you reposition, just like anything, if you reposition, then
So are you repositioning up or back or both?
So the key is you want to reposition up. If you look at people who are dissatisfied with their facelift, one of the things they say is that they feel that their face has been pulled, and they will do this. They feel like their face has been pulled.
Yeah.
But then when they come to...
So that's just not part of getting a facelift?
But then
you're going to have that pulled look?
But what's interesting, Randy, is that when they talk to their friends or when they come to their doctor's office, they pull vertically. They say, this is how I want to look, doc. Right? This is how I want to look, doctor.
Okay.
But then when they say that the result they got, they pull this way, because that's how it's been pulled.
Well, logically, what you're saying makes sense. So why isn't every plastic surgeon doing it this way?
Well,
and is this what you talk about these meetings?
Yes.
Okay.
So again, the key is minimizing bleeding, because if you have a lot of bleeding, then you can't go far. You can't dissect far, because blood will stain the tissue area. And then when the area is stained with red blood, you can't tell what is what. So the surgeon wouldn't want to go further in. And so another bad thing about pulled look, besides just pure aesthetics of being pulled sideways, is that they may look okay, or they may look fabulous, or they may look amazing initially. But what you have to ask is, how long does that result last? Because if you think about it, they could look great before and after photo because they've been pulled and they were very draped, they had a lot of looseness about them. But then you have to ask, okay, how long is this gonna last? Now, so if you pull, it's not gonna last long, only about a few years or so.
Okay.
Whereas if you reposition, then rather than being held by a suture that's being pulled, A repositioning means that cells are now positioned at a new area. And then when a cell is positioned in a new area, then it's being supported from bottom up, from tissue-tissue healing versus pulling with the suture.
All right.
So it's a much longer lasting.
So that's
result.
why the results are longer lasting, and they look
And they don't
natural?
look pulled. Exactly, and they don't look pulled.
What do women want? Do they want to look younger? Do they want to look prettier? Do they want to look different? Is it all of the above? I mean, what are the main reasons why people want to do this in the first place?
Well, I mean, I think women want to, obviously, they want to look younger. I mean, if you look at young women, most young women are just attractive, right? And you look at if you ask any woman who wants a facelift, and you ask them, when you were younger, how did you look? They would all say, I really liked the way I looked.
Okay.
And I think what they're really looking for is they really want to just go back to the way they used to look. But then if you have to, as a doctor, as a scientist, you have to break it down and say, what is it about their look that they really liked?
Do you have them bring in photos from when they were younger?
Well, they could bring in photos, but what you have to ask is, and then you kind of look at it together. And one of the key feature is a very nice jawline.
Okay.
And if you ask patients who are coming in for revision surgery, you have to ask, what is the number one reason they're having a revision surgery? And that's because they're not correcting the jowls. You could correct the neck, you could correct the midface, but this jowl area, and then you look at when they're in their 20s or 30s, they're having that nice jawline is what gives for instance, for a woman, a very feminine, youthful look. And
Okay.
same for
the neck is like one of the first things that goes with age, right?
neck,
Once you get to 40 or so, your jowls start to drop.
jowl, neck, and all that, right?
Okay.
And so I think what they really want is to look like the way they used to. Again, as you said, Randy, not pulled, but when you reposition, then it's not under tension. And so, and then everything is smooth because, we hear about mid-face lifting, we hear about neck lifting, but aging is a one continuum because, not to be too specific, but the layers of our face is called the SMAS and platysma. These layers are actually one continuous layer. They just have a different name.
Okay.
But it's a continuous layer, and they fall together. It's not just the one upper part falls and this part falls separately at a different time. They fall together because gravity acts on it in a continuous layer. So you want to reposition together. And so when the neck, mid-face, and jowl, when they all get lifted vertically, that's how you get the really nice jawline,
A natural look.
a natural look. Yes. And then another thing, Randy, I didn't get a chance to mention, is that you mentioned about how to really do this. Okay. And I think it's really important that people understand some of the advancements that are coming out right now. I mentioned to you about fluid and how fluid will find this area of least resistance. Mm-hmm. But another really benefit of operating with fluid is that, just think about it, our tissue is made up of 70% of fluid. So inside, so our skin right here, this is basically nothing but leather, right? Skin is just a protective layer.
Okay.
But anything underneath our skin, from between the skin to the bone, the soft tissue is immersed in fluid.
Okay.
But when we are operating, let's say you look at a video of surgery.
Okay.
Any video of surgery, you see a lot of smoke. And what is that? Smoke means something is burning.
Okay.
Right? And so typically surgeons operate using an electrocautery. It's a technical term for a device to cut through.
Okay.
And as you're cutting through, you're burning all this tissue. And then so what patients are experiencing is they're experiencing remember I said about bleeding, how that causes pain, mm-hmm. Trauma causes pain, and also burning causes pain. And so but then when the tissues are immersed in fluid, then now you don't burn, because even if you have to get a blood vessel that is in the way, you have to interrupt it. Well, you're only getting the blood vessel, but you're not burning the surrounding tissue because your surrounding tissues are immersed in fluid.
Okay.
So throughout the surgery, your cells don't desiccate, which means they don't dry up. So your cells are still incubated, they're still immersed in fluid. So as I said, I've done research, basic science research with the Howard Hughes on tissue regeneration. And cells, during surgery, these cells, if they dry up, facelifts, facial rejuvenation surgery, they take 3, 4, 5, 6 hours. And during that surgery, their tissues are being burnt and they're left open to dry air, open air, and they dry out.
And what does that mean if they dry out? How does that affect the result? Help me understand that part.
So what patients want is not only do they want to look like when they're younger, they also want to feel like the way they looked. So what happens is that younger people, their face is very smooth. When you feel it, there's a nice feel to it.
Okay.
But one of the problems that I see in facelift is that after the surgery, after this kind of the pulled look, again, the photos is not really an accurate, complete picture. It's because you have to look at the internal burn. If you just look at a burn patient, their skin is very hard and tight, and it's not smooth. And so when you're using that electrocautery, you're burning these cells. Our tissue is just made up of cells and collagen.
So you don't use this cauterizing tool?
I only use a cautery when I have to get the key vessels. But again, because I'm operating in a layer that naturally opens,
okay,
I wouldn't have to use the electrocautery. But typically, surgeons would have to use electrocautery to cut through the layers because they don't want to open up naturally. And so what happens for facelift patients is that when they feel it, they just feel like, it just doesn't feel as soft as I used to. Why? Because of the internal tissue burn. Number 2 is that a lot of the vessels has been cut, so then the skin quality is not as good. I know, Randy, you're into health. I think so many people are into health. And so you live in a great area near the beach, and inhaling great oxygen with less pollution is important. Eating healthy diet, all these nutrients are important. But oxygen and nutrients, how do they get to your cells? Through blood vessels. Okay. But if you're cutting these blood vessels, then now they don't have the channel to get there.
So you don't heal properly?
Now, you will heal, but it's not about healing immediately. It's about long-term, how do they feel?
Okay.
Yeah? And then you want the skin quality to be nice and supple, and just youthful.
Now, you don't use traditional anesthesia. You say you just need local. Tell me about that.
Yes, I only use local anesthesia, Randy. And the reason why I use local anesthesia is really just to decrease the risk of surgery. So many patients, they may want to do surgery, but they think of surgery and they say, oh my goodness, this is scary. There's a lot of risk. I don't want to take that risk. I don't want to hear about it. We talked about risk, and you said, you know what? Risk is something that people just don't want to hear. However, I think that informed patients a patient should know what surgery is really about. And I think we have to be honest about risk. So there are 2 types of risk in surgery.
All right.
One is surgical risk, and then the other is anesthesia risk. So surgery is you're using your hands, and so something like playing a musical instrument or playing a professional sport, there's a hand-eye coordination. So if the hand-eye coordination is not that great, then you are going to make errors. Just like an elite athlete or elite musician, international soloist, the way they perform is different than, let's say, somebody who's an amateur.
Okay.
But then another very important thing is poor visibility. So what does that mean? So in anything that we do physically, let's say something that you and I or anybody would do, which is driving.
Okay.
That requires something that requires vision. And what happens is that, let's imagine you're driving in a dense fog, or you're driving at night and it's snowing heavily. Then I would say, Randy, driving is very dangerous. And the only reason is because of poor visibility.
Okay.
And so in surgery, if there's bleeding, again, we're talking about
poor visibility,
face or anywhere, poor visibility. If there's bleeding, things are stained, you can't differentiate what is what. And I think that's where surgical errors occur. But again, if you follow a minimal bleeding technique, then it's like driving in a clear day.
So it's more
driving in a clear day is not considered dangerous, right? So that is kind of the night and day difference in terms of minimizing surgical risk.
Okay.
Then how about risk for anesthesia? You asked me about why I do it under local anesthesia. So then the second type of risk is anesthesia risk. And there are three types of anesthesia. One is a general anesthesia. The second is an IV sedation anesthesia. And third is a local anesthesia. So then let's look at these three anesthesias.
So local is you're just numbing the area you're treating.
Right, local is exactly just numbing the. So then the first anesthesia is general anesthesia. And the general anesthesia is you're intubated. But the problem with general anesthesia is that if the surgery lasts and you are past 3, 4, 5 hours, then there's an increased chance of blood clot that can form in your legs. It's called a DVT. Okay. And if the blood clot forms, so that's why you wear compression boots and all kinds of devices to try to prevent that. But when that blood clot forms and it traverses to your lung, then you can develop what's known as pulmonary embolus, or basically what it is a clot in your lung, and that can be life-threatening, or it could make you have difficulty breathing. So that's the risk of general anesthesia. How about IV sedation anesthesia? What that is that it puts you to sleep through an IV.
Yeah.
But the problem with that is that patient can be overly sedated. And then when you're overly sedated, then you can just basically not breathe. And that can lead to a very, very
so it can be dangerous, yeah.
Extreme dangerous just because you're not breathing, you're overly sedated.
Okay.
Another thing about general anesthesia and IV sedation is that basic science research have now shown that general anesthesia and IV sedation, what it does is that it's putting you in a comatose state. Your brain is put to sleep. When that happens, it can lead to memory loss.
Okay.
So this is basic science research. So these are risks that are out there, and that I'm not saying that it will definitely happen to you, but that these are risks that we could avoid. Then how about local anesthesia? Well, according to the American Society of Anesthesiology, they say that among all the methods of anesthesia, local anesthesia is the safest.
Okay.
And why? Because you're not paralyzed, you're not intubated, you're not put to sleep, you're not knocked out through IV sedation, so you're breathing on your own, you're fully aware of what is going on. So by just
but they're numb, they can't feel it really.
They don't feel it, so they're comfortable, they don't feel it. And then we're operating at their natural physiologic state. So the whole principle is, how do we operate at a natural physiologic state? Because if you're put under general anesthesia or IV sedation, your blood pressure drops. So and surgeons like that, because we all like that, because when the blood pressure drops, then you bleed less. So we don't necessarily see. So, but then when you wake up, then that's when the small vessels start leaking. And that's what we all hear about people who had bleeding after surgery and this and that. Well, they weren't bleeding before because the surgeons cauterized everything.
Yeah.
Right. So the key point is, how do we operate in your normal physiologic state? So it's not just to get a great result, but so that there's minimal risk to your health as well.
So if everything works out well, how soon could a facelift patient go back to work?
I would say my patients typically take about a week off.
Okay.
And then so they may go back to work about 2 weeks later. But again, I think what's important is that they don't take narcotics. The next day, they feel exactly the same as the day before the surgery or the day of surgery.
Okay.
Because they didn't lose blood. They don't have nausea and vomiting. Because none of all these medications are in their system that's causing them nausea and vomiting. So the very next day, they feel exactly the same as right before the surgery.
Okay. Yeah. Okay. Now, after it's all done, what kind of and we have about a minute and a half left. What kind of transformations have you seen?
I think that patients, I just see an increase in self-confidence. And of course, they feel great about the way they look and this and that, they're happy. But the reason why I see this increase in self-confidence is that, they typically, what they tell me is that they have seen themselves in the mirror and they just didn't like it. But then after making this decision, what they have done is that they have taken a proactive decision to do something about it. And when the result, it turns out the way they wanted it, now they have the confidence to tackle on other issues of life.
Okay.
And so now I just see more, radiance, vibrance in them.
Okay. When should somebody get a facelift? Final question. We're completely out of time.
Sure. So, the facelift, obviously when it bothers them, I think they should do something about it, because I do see this dramatic increase in self-confidence. But also for people who feel that they're older and they're afraid that, maybe, all these risks and they don't want to, they're concerned about that. Again, now this option is there. You can do surgery with minimal risk because the surgeries are under local anesthesia. There's really such a minimal risk to your health that we can do a full extensive surgery, actually much more than what you would do under general anesthesia and IV sedation. So you're really doing the definitive surgery without adding additional risk to you.
Okay, good. We are completely out of time. Final message, somebody watching this, they've heard what you had to say. And maybe they want to consult. What's the first step to see you?
I think what's important is that they visit their plastic surgeons and a board-certified plastic surgeon, and not only just see before and after photos, but I think that it's important for them to see videos of before and after photos of their movements and just how naturally they look. Because I think if you just look at before and after photo, it's just a very static photo. But if you see a video of them moving and then see long-term results, and again, what we talked about, when you just pull, you may look great for the first few years, but how long is this going to last you? Because it is an investment for you. And so I think it's important that you see all of that.
Okay, good. So when they go to your website, make an appointment, they see you. You always do your consults?
I always do my consult.
All right. Well, it's a pleasure having you on the show.
Oh, thank you, Randy.
All right. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.